What do you do when you're struggling with ADHD, anxiety, or overwhelm? Do you just try and distract yourself and keep busy, push even harder, or perhaps you just don't want to think about it? You go into denial. Or what if I told you that the answer might not be to try and stop anxiety or get around it, but that the only way is through? In other words, an effective way to manage anxiety is actually to listen to your body and what it's trying to tell you. And so today, I want to share with you a simple but powerful somatic technique called Pendulation, which was developed and popularized by Dr. Paul Levine, an expert in trauma therapy. And yes, this technique can be helpful for processing and managing trauma, but it's also very effective generally for anxiety and overwhelm, especially when you're neurodivergent. Hi, my name is Jamie Vasilian, ADHD coach and hypnotherapist who also has ADHD, and I love to help people like yourself and make content designed to help you not only understand your uniquely wired brain, but also how to manage it. And if you're not already subscribed, then please show your support to this channel to help us not only keep going, but growing so that we can all grow together. Much appreciated. The pendulation technique has become a staple in my therapy practice because clients find it incredibly helpful. For me, my own lesson in the power of pendulation came during an unexpected moment when a hornet flew into my office. My chest tightened, my heart was racing, and I couldn't tell if what I felt was anxiety or excitement. Maybe it was both. And you've probably had moments like that too yourself, times when you felt nervous and excited at the same time, or even sadness and joy together. That's a real life example of what we call pendulation. Now, that encounter with the hornet gave me the chance to practice exactly what I teach, to practice pendulation in the presence of that unwelcome guest, realizing that even when part of me feels anxious, another part of me feels neutral or even relaxed. It's not just knowing about this, but actually practicing it, experiencing it. And that's what helps you step back, see the bigger picture, and regain a sense of control. So today, I'm going to guide you through pendulation and show you how you can use it to regulate stress, ease anxiety, and even begin processing trauma and get back in control of your anxious or overwhelmed neurodivergent brain. Now, I recommend you stick around to hear more about this, the concept of pendulation and how it works. But if you're eager to practice the technique right away, then I've time-stamped it for you. It's in a section called Guided Pendulation, so feel free to skip forward if you prefer. Pendulation is a technique developed by Dr. Paul Levine, the founder of Somatic Experiencing and a leading expert in trauma. While it was originally designed to support trauma recovery, it's just as powerful for everyday emotional processing, especially when it comes to managing anxiety, overwhelm, or stress when you're neurodivergent. The idea is simple. Instead of being stuck in stress or shut down, you gently swing your attention between two body sensations, one that feels activated on the one hand, tense or anxious, and one that feels grounded, neutral, or surprisingly okay. Think of it like a pendulum swinging side to side. On one side is activation, anxiety, tight chest, racing thoughts perhaps. On the other side is calm, your feet on the floor, steady breathing, or another neutral body sensation. Now, often when we're anxious, overwhelmed, or responding to trauma, we tend to get hyper-focused on the anxiety and not notice the bigger picture. But pendulation reminds our body, our nervous system of that bigger picture. This back and forth pendulation reminds the nervous system how to reset itself once again. To remember that swinging to the side of tension or fight and flight is in fact a normal, healthy part of the process. But also to remember that a pendulum can only pendulate, so to speak, when it is free to swing in both directions. Research shows that body-based or somatic approaches can ease trauma, reduce anxiety, and improve regulation. So why is pendulation important for ADHD and neurodivergent specifically? Because many of us deal with constant anxiety, overwhelm, procrastination, or even chronic fatigue and pain. And they say that when you are neurodivergent, when you have ADHD or autism, you hear thousands of more negative messages across your lifetime compared to neurotypicals. In fact, research suggests that a child with ADHD hears about 20,000 more critical or corrective messages by the age of 12 than their peers without ADHD. And that's a huge weight to carry, a huge burden. Being told that you're lazy, careless, disruptive, or not living up to your potential over and over again. This constant drip of criticism adds up and it shapes how we see ourselves, even if it isn't true. That's why so many of us carry what I call hidden trauma. Not always the big dramatic events, but the long-term build-up of unmet needs and repeated invalidation. And that can make emotional regulation even harder for people with ADHD or autism. Now, ADHD is also linked with poor interoception. Interoception is basically our sixth sense. That's right, we do have more than 5. We're not talking about ESP. It's the sense of knowing what's going on inside your body. And this often lags when we're neurodivergent, which means we'll have difficulty sensing what's going on inside of our bodies. And that makes nervous system regulation even harder for us, which means we're more likely not to notice if we're thirsty, hungry, need the bathroom, or whether we have some kind of unprocessed emotion or unmet need, which of course can all spiral into further emotional dysregulation, overwhelm, or even trauma responses. Pendulation is a way to practice interoception safely. It's a simple somatic exercise for ADHD, overwhelm, and anxiety relief, helping you feel calmer, more in control without overthinking. So let's try pendulation together now. You can simply practice this by focusing on how your body feels right now in this moment. Or you might like to bring to mind some recent stress or concern that you would like to process. Now you might want to close your eyes. Take a deep breath in through the nose and a longer exhale, breathing out through the mouth and letting go. Now, focus inwardly on your body and imagine scanning your body from the top of your head to the tips of your toes. And notice a part of your body that feels activated or tense, maybe your chest, shoulders, or head, wherever it may be. Just notice that air of tension or discomfort. So go ahead and identify that area of your body that feels uncomfortable right now. And when you locate that area of your body, don't try to change anything or stop anything from changing. Just notice what you notice. Breathe into that area of your body, really listening and being present with it. Now scan your body once again and locate a part of your body that feels okay or neutral, like your feet pressing into the floor perhaps, or the weight of your body in the chair. Spend a few moments breathing into this part of your body that feels okay or neutral. And now, move your attention back to that part of your body that felt discomfort. As you return here, notice whether this part of your body feels the same or different compared to last time. Not trying to change anything or stop anything from changing, but simply noticing what you notice. That's it. And after a few moments, focusing on this part of your body, return your awareness to the other part of your body that feels neutral or okay. And once again, return your awareness back to that part of your body where you felt the discomfort, and notice now how it feels, the same or perhaps different. Now, let's do this one more time, returning to that part of your body that feels okay or neutral. Spend a few moments here. And then returning to that part of your body where the discomfort is. And once again, noticing whether it feels the same or different. And finally, just spend a few moments scanning your entire body and just notice how your body generally feels overall compared to how it felt before. Noticing whether it feels the same or different. Perhaps you notice that there has been a release or relative relaxation of some kind within your body. And now, returning eyes open, noticing what you can see, hear, and feel. Feet touching the floor, secure and grounded. Normally with pendulation, we would practice that movement from discomfort to comfort about 3 to 5 times. Anyway, that's pendulation, a simple but powerful somatic tool for ADHD trauma recovery and nervous system regulation. Pendulation is one of the simplest ways to manage ADHD overwhelm, anxiety, and even procrastination. I've always noticed there is a big link between procrastination and anxiety. And I taught this technique to an ADHD client recently who wanted to stop procrastinating. Afterwards, he explained that he became aware of something that had been playing on his mind and decided next time he was going to work, he was going to practice pendulation before starting. And he reported that this helped him to get unstuck and get more work done. In fact, he never complained about procrastination again. His story illustrates the common connection between procrastination and anxiety when you have ADHD. By training your nervous system to swing between stress and calm, to kind of take the rough with the smooth and go with the flow, as they say, you build resilience and confidence. So next time you feel overloaded, try pendulating. It's a nervous system reset that you can do in just minutes. And if you'd like more ADHD-friendly tools for anxiety relief and emotional regulation, then why not check out my free guide, Eye of the Storm, where I teach you the same 3-step system that I have taught to hundreds of clients of ADHD to get unstuck from overwhelm and anxiety. And you can find that, find the link for that down below. Anyway, thank you for listening, and I'll see you next time. Bye for now.